School has already begun here in the Lowcountry. We are getting a feel now for what national programs might be available to our students and their parents, and we're pleased to get a chance to talk with Dr. Grant Baldwin, the director of the CDC's Division of Overdose Prevention. Dr. Baldwin, welcome to WHHI. Let's talk about how substance use and mental health are linked and how you guys have a program that's going to target that this fall.
Yeah, so that we know that as our teens face stress, anxiety, worry, and even bouts of depression, we need to make sure that they're turning away from substance use and turning towards healthy coping strategies. We're in the midst of a mental health crisis. 4 out of 10 American high schoolers report feeling a prolonged sense of sadness and hopelessness for over a couple of weeks, and 1 in 5 report contemplating suicide. There's real consequence if teens do turn towards substances in the immediate term and long term. Immediately, that turn is toward an environment that includes fentanyl, which even on a single use can lead to overdose or even death. And long term, we know that early substance use initiation is linked to problematic use in adulthood, including the development of addiction, as well as a range of other health problems. And that's why it's so important to intervene early.
All right, you guys are creating a campaign called Free Mind that is going to target all of this. I think a lot of parents have a surface understanding of what the problem is. You've added some numbers. What will Free Mind do to help that situation along and help folks find more answers?
Yeah, so folks can go to cdc.gov/Free Mind. So for parents and caregivers, we have fact sheets and conversation starters to begin to have those crucial conversations with your teen that may be struggling with a mental health challenge. And for teens themselves, the campaign is really teen-centric. It's a message of empowerment and personal agency, that teens are really the captains of their own ship. Beyond making the connection between substance use and its impact on brain development, more importantly, the campaign says it's okay to not be okay. It's okay for you as a teen to reach out to your parent, caregiver, or other trusted adult to make sure that you can be linked to a licensed professional counselor or social worker, or other resources that can help you meet a mental health crisis or challenge. And to that end, the campaign includes a bunch of teen-centric materials, videos, a graphic novel, an interactive gaming app, all designed to make sure that your teen understands, both when they're having a mental health challenge, that it's okay to not be okay, and how to make sure you get connected to the services and supports you need.
As much as teens are technologically advanced, and as much as they are probably, having had them recently, not so much parent advanced with talking to their parents, I think this is critical to give them a place to go that's not their parents, but is something that they understand, and that's technology.
Yeah, absolutely. And parents can look for some warning signs to see if their teen is struggling with their mental health. That might include things like, and we all, as a parent of a 14-year-old myself, we all know our teens the best. That may include changes in mood or unusual irritability, being withdrawn in ways that you don't expect, sudden weight loss or weight gain, or school performance changing in ways that you don't anticipate it. Those can be signals to us as parents to begin to have those non-judgmental, open-ended conversations where our teens feel safe and heard, and ultimately we can use those as a bridge to connect them to the support and services they might need.
Let's hit that website again.
Yeah, it's again, cdc.gov/Free Mind.
All right, Grant Baldwin. Dr. Grant Baldwin, Director of the Division of Overdose Prevention at the CDC's National Center for Injury Prevention and Control. That's a long business card. Dr. Baldwin, thank you so much for joining us. We appreciate it, and hopefully we'll get a few folks to log on and maybe learn a little something extra. We appreciate it. Thank you.
We love that. Thanks so much.
All right, we'll be back with more of the WHHI Daily News right after this.